So, respected speakers, our moderators and session coordinators, a warm welcome to everybody. I welcome all of you to LMHI 2021, the Global Colloquium. We have our moderators with us, Dr. Bharti Girdhar and Dr. Deepika Bhatnagar. They would introduce our chairpersons, followed with our speakers. And now I'll like to hand over the virtual lives to our moderators. Ma'am, over to you all. Thank you.
Good afternoon, everyone. I'm Dr. Bharti as a moderator for today's session. I extend a warm welcome to our chairperson, Dr. Mohit Mahajan. And sorry, Dr. Petra is not available today. So greetings to our esteemed speakers also. And topic of the today's session is challenges of veterinary medicine and agriculture. Let me hand over the dice to my co-host, Dr. Deepika Bhatnagar, to begin the session with. Please, ma'am.
Thank you, Dr. Bharti. And I'm looking forward to this session, as this session is going to be quite exceptional and distinct in the sense that till now we have seen homeopathy working on the human beings wonderfully. So now let's see how homeopathy works well on the plants and animals. Here is our speaker for today. The first speaker is Dr. Surjit Singh Makkar. He's from India. He'll be presenting his abstract on the topic veterinary medicine, the topic being homeopathic treatment of a rectal prolapse in a kitten, a case report. Over to you, Dr. Surjit Singh, sir.
Yes, sir. Thank you, ma'am. If it is audible?
Yes. Yes, sir, you are.
I should share my screen.
Please do.
Thank you. Thank you, who has given us a chance to present our case. So really, homeopathy is working very well in animals. I have 36 years of experience in using homeopathy in veterinary science. I have treated right from sparrows to elephants with homeopathy. Successfully treated so many cases with homeopathy. So this is the introduction. How this I have treated one case of a kitten rectal prolapse. This case is from Kolkata. Rectal prolapse in either is partial or incomplete in nature and is defined as a double layer vagination of the rectum through the anal canal. This is how we define this rectal prolapse. The common associated causations, we always follow the rules of how to treat the animals and how to take the case. That is LACM, that is location, etiology, concomitants, and modalities. We vet homeopaths, we always follow these things. And while taking the totality of the symptoms, we always follow the rule of PQRSU symptoms every time, in every case taking. That is clear, rare, uncommon symptoms. We need those symptoms unless and until we find the totality of the case and we find the simile of the case. We are not going to treat the case. So this is the first essential part of our veterinary homeopaths, because in our veterinary course we are taught like this. We have to observe our animals from every angle, because they can't speak, they can't describe themselves, but they behave so naturally. It is very, very easy to find the symptoms once you know how to find the symptoms in them, how to observe them. So this is how we veterinary homeopaths work all together to find simile and to take the totality of the case. Then we reproduce the case, and then we give this homeopathy medicines, homeopathy remedies, and they give wonderful results. So this is the case I have treated. I have treated so many cases of rectal prolapse, but it's one case which I'm describing over here. This is the associated causations. As I already told you, we are supposed to define ourselves on LACM, that is location, etiology, concomitants, and modalities. So here the cause may be this enteritis, endoparasitism, associated tenesis. This is a already reported by Fossum in 2002. So rectal prolapse is one of the most encountered surgical conditions involving the rectum in all domestic animal species. This is Tyagi and Singh. In India, we are naturally more concerned with the rectal prolapse. There is a prepartum rectal prolapse and postpartum prolapse in our large animals like cows and buffaloes, which are the backbone of our economy of our country. So here I'm defining only the rectal prolapse in a kitten. Otherwise, I have treated so many cases of rectal prolapse in cows and buffaloes. Here, the surgical intervention is the most common treatment methodology adopted. But however, in cases where surgery is not indicated, it is required, it is opted by the owner. So we have to look after some alternative treatments. So finding alternative therapies for clinical management is a need of the hour. The objective of this study is to report successful management of rectal prolapse in a 5-month-old kitten having 4 episodes of prolapse in 5 days. The homeopathic medicines used in this case was CPR 200 and Ruta-G 200. The patient revealed a favorable response by 2nd day of treatment. Note this point, my dear friends, and all over fraternity over here. We got a favorable response by 2nd day of the treatment and complete healing on the 7th day. This therapeutical protocol used was conclusive and it re-established the normal intake of food and energy level. Yes, we have to take all these things into account. Hence, homeopathic treatment can be considered as an alternative therapy for clinical management of rectal prolapse in felines and canines. This is a case history and observations. A 5-month-old kitten weighing 1.5 kg was presented by a telephone conversation from Kolkata. Since I treat all type of animals, right from sparrows to elephants, with my website, that is, we do for video conferencing, and all the reports I got on the WhatsApp, and then I prescribe those medicines to the owners, and definitely we are every time we have some full conversation with the owner of the patient. So India with a complaint of rectal prolapse 4 times now in last 5 days. At time of consultation, she was dehydrated and was fluids under vet's guidance. Initial clinical examination by vet, normal temperature, tachycardia, that is 190 beats per minute, tachypnea, that is 36 breaths per minute, urination was normal, but there was the absence of defecation from last 2 days as reported by the owner. The abdomen was markedly distended and the animal gave a arched back appearance. Yes, this we have to observe, arched the back appearance. The animal was so subjected to ultrasonography, which reveals negative results for the sign of interception. This may be the cause. That's why we have ruled out interception of the intestines. So based on the history, clinical findings and ultrasonography findings, the clinical diagnosis was to be of rectal prolapse. Hence, the owner was advised for surgical intervention for fast recovery. We have advised the owner that you can go for surgical intervention, but owner refused to opt for surgery due to non-availability of surgeons, due to COVID scenario, because at that time COVID was going on, young age of the patient, post-issue and post-surgery recovery period. This was definitely the reasons given by the owner of the patient that she doesn't want to go for surgery. And with the consent of the owner, we plan to manage the condition with alternative therapy, that is homeopathy. According to history provided by the owner, these are the following symptoms, that is lethargy, number 1, weakness, mental exhaustion. Every time we take the case in veterinary homeopathy, we have to take some mental symptoms. Mind symptoms are very, very important for us in order to find a PQRS symptoms, peculiar, QR, rare, uncommon symptoms. Okay, so there's the inactiveness that is worked out in close association and observation by the owner. These are the findings given by the owner. So there's what is the location? That the location is rectal prolapse with staining to pass bowel movement. This is a location. I already treated this. What is it? It may be etiology, it may be endoparasitism, it may be something like that. Then other symptoms are observed by the owner. They are dehydration, too small and fragile kidney, coughing, difficulty in breathing, sneezing, symptoms and observations were subjected to rapidization. So after rapidization, we have taken from Boeing Boeing respiratory, we have taken first symptom as a mind symptom, that is impaired intellect, impaired mental exhaustion, weakness. Then we have taken from veterinary respiratory, that is by me, and that is by this published by this homeopath, vet homeopath. Okay, these generalities we have taken dehydration. From veterinary respiratory, we have taken rectum, that is prolapse of the anus. Then we have again taken the rectum of the prolapse of the anus. Then we have taken rectum and anus both, prolapse of the rectum. Then concomitants we have taken during stool, anus and rectum prolapse of. This way we have taken as a concomitant, as we have already defined, LACM. Okay. So after rapidization, we advise the patient as a sepia and Ruta 200 twice daily for 7 days, and recommended to dissolve 2 to 3 drops in 2 ml water, and to draw this medicated water with syringe and to put directly in the mouth or nostril of the patient. How this we advise, how to give the medicine to the patients. It may be different in birds, right, from parrots, right? It may be different in pigeons. It may be different in cat. It may be different in monkeys. It may be different in elephants. It may be different in some cows food medicine to our patients. So this is definitely one way: 2 to 3 drops in 2 ml water, draw this medicated water, and put directly in the mouth or nostril of the animal. So these are the super sensitive mucous membranes of the animals. One is mouth, another is nostril, and another is the vagina. Okay. We also recommend owner to wash the affected area with cold or iced water. Yes, we have to manage every time rectal prolapse. You can't say you have given the medicine and you are not managing and you have cured the case. No, impossible thing. You have to manage the case. Either you have to put some gelatin jelly, or you have to put some this ice or cold water in order to place that prolapsed part into the mainstream. So we have overused gelatin jelly and calendula ointment. So definitely this is going to be this management of the case, how to manage this prolapse. The owner reported the prolapse reduced by 2nd day. The owner reported on 7th day that her prolapse and dehydration are completely fine, but the chest is congested. Now the other symptom is there and breathing is difficult. On these symptoms, we have given Brania 30C, because the Brania is the one medicine which gives for the chest, and which, whenever there is inflammation of the mucous membrane of the lungs, we always prefer Brania. So after 3 days, the owner reported that her prolapse, dehydration, and breathing problem are completely fine. These are the words of owner. Okay, she is fully active with full energy. So this is definitely one thing we every time we describe what is the activeness and full energy. She's taking proper foods now. Big thanks to homeopathy. This is the proper wording of the owner. So this is the before treatment. You see over this the prolapse of the rectum over here. After management and after giving the treatment, now it is fully cured. So this is how homeopathy works. You can say it is wonderful, not like that. So these are owner's wording. Her prolapse, dehydration, and her breathing problems are completely fine now. She is fully active with full energy. She is taking proper foods. Big thanks to homeopathy. So keeping in view the health of the patient, further medication must stop, and the owner was advised to consult again after 2 weeks for follow-up. The owner reported complete recovery of the rectal prolapse. This is in figure 2. No occurrence was reported over a follow-up for another 3 months. So can I show the video over here? Small video.
How long is it, sir?
Only 1 minute.
Oh, so can you just keep it for the end of the session, if you don't mind?
Yes, yeah, no problem.
Yeah,
okay.
So we would definitely look forward to watch your video.
Okay.
Thank you very much. It was a wonderful presentation.
So these are the results and discussions. Prolapse of reactives due to over and persistent staining. Hello.
Hello, Hanji sir.
So these are results and discussion.
Okay.
Prolapse of rectum is due to over and persistent staining, which can become common in clinical conditions like diarrhea, tenesmus, lower urinary tract, and prostatic disease. It is reported higher in young parasitized animals, especially with severe diarrhea. This is shedding. If it is okay?
Yeah, we are able to watch it. So kindly increase the volume. Makar sir, the volume is not there.
Yeah, it is okay now. Yeah, the volume is very less.
Okay. Yeah.
I think we should. So this is how I treated this case.
Okay.
Yeah. Should I conclude this one?
Hello. Is there another video, sir?
No, there is no other video. I will conclude my case.
Yeah, please go ahead, please.
Yeah. So prolapse of is due to over and persistent staining. The incomplete rectal prolapse arises due to backward gliding of submucosa and mucous membranes of the muscular cord to form a circular position. How this and prolapse is there? The management of rectal prolapse usually depends upon the degree of prolapse, viability of the tissue of elasticity, and number of episodes. So on the other hand, poplexy can be considered a better option than other surgical techniques. So this is how we treat this rectal prolapse in other animals. So in the present case, the complementary treatments stand out as a promising alternative. Among them, homeopathy is a safe medical treatment that doesn't intoxicate patients or depress the immune system and biological responses of the body. That's why we use homeopathy. It maintains homeostasis and develops a long-lasting and effective improvement in disease control. This is reported in Valley et al. In 2015. So treatment of choice over here is present work used highly diluted and dynamized medicines to treat symptoms or diseases. Homeopathy uses the natural healing tendency of the organism. So this is the beauty of the homeopathy by assisting the immunity for the complete re-establishment of organism. So the rubric taken is into consideration for prescribing CPR is from Kent's laboratory was dehydration, emaciation. Although the kitten eating a lot when associated with the constipation and prolapses, a tonic relaxation of support of the uterus. CPR is well known and clinically used remedy for uterine pathology, especially prolapse. This is reported by the Warwick William. As homeopathy takes into consideration of the totality of the case, that is the most important. And after taking the PQR symptoms, we take the totality of the case. In this case, we have also taken the totality of the case. This is very well responded to the CP and Ruta-G, both known to have tendency for ligaments and tendons. Everything is written in the Materia Medica books. That's why we prefer all of our vets to read this Materia Medica every time and each time thoroughly. Pain which are often sudden and severe in animal due to over-exertion and injury to joints, ligaments, tendons. So Ruta is the one of the best medicine and preferred choice of remedy for ligaments and tendons. The use of the two remedies at the same is an area of exploration in animals, as the prescriptions depend on these uses on observations and pathologies. Various authors have used the constitutional remedies. Of course, we do use constitutional remedies in cases of while taking this, if it is a pulsatilla patient, if it is sulfur patient, if it is arsenic patient. So we have it, most probably we take some constitutional remedies also. Along with other remedies being used as sportive targeted medicine. For example, in the case of CPA was used as an indicated remedy of the choice, and Ruta G was given as a sportive medicine having direct known action on the ligaments. That's why we have used it. So this is the conclusion. This successful study proposes that homeopathic treatments can be considered as a viable option in cases of rectal prolapse in felines. It has yielded important observations such as it can be given for quick recovery of the patients, has advantages in the terms of cost benefit for the patients as well as for the owners, has lower rate or no possibility of relapses. Very, very important. Lower rate or no possibility of relapses, and no side effects described till date. Further, similar case reports, series, and rigorous research must be undertaken to establish the utility of homeopathy in feline diseases. So these are some of the references. This is the homeopathy, wet homeopathy repertory we have used from homeopath wet. And so this is the conclusion that homeopathy works like wonders in this prolapses. As we already told, we have used with this homeopathy for the rectal prolapses in case of cattle and buffaloes, because they are the backbone of economy of our country, that is India. So I have treated so many cases of rectal prolapses. You can say more than 1,000 of cases with this homeopathy. And of course, we use constitutional medicines followed by we follow the principles of LACM. We follow the principles, like we find the symptoms like PQR symptoms, and definitely we have treated so many cases only by these observations. Thank you, dear friends. Thank you so much.
Thank you, sir. This has indeed been a wonderful presentation. Now I would want to welcome our esteemed chair, Dr. Mohit Mahajan. He is the chairperson of this session. Dr. Mohit Mahajan is the vet gynae surgeon. He is a PhD from Department of Veterinary Gynae and Obstetrician from GB Pant University of Agriculture and Technology, Uttarakhand. Welcome, Dr. Mohit Mahajan.
Good evening, everyone. Good evening, everyone in the panel. Thank you for getting me here today. And I'd like to say to Dr. Sujit that this was a brilliant presentation and quite amazing as well, especially for me here in gynecology, where we quite often, deal with prolapse cases, even considering uterine as well as rectal prolapse cases. And your presentation was something that was taken into account and considered as a baseline today for me to pursue homeopathy medicine from now on in veterinary medicine as well. I feel personally, as a starting note, that homeopathy is quite an ignored medicine, especially when it comes to veterinary sciences. And all of our basic therapies are usually based on surgical aspects or allopathic aspects. And we totally rule out the basic aspects, that is the homeopathy, that might bring about being a game changer today in this 21st century in managing severe conditions such as a case of rectal prolapse, as discussed by Dr. Sujit here, which might be really, really fatal as considering the age and the condition of the animal.
Yes, I also felt that it's a wonderful case. I would like you to ask some questions from Makar sir if you want.
Yes, most welcome. Most welcome.
I'm sorry to intervene in between. Can we keep the question answer sessions towards the end, because we are running a little short of time?
Sure, Mr. Hime.
Thank you, Dr. Deepika.
Thank you, Hime. Now I would like to hand over the dais to my co-host, Dr. Bharti Girdhar, for calling upon the next speaker.
Thank you, Dr. Deepika. May I now call upon Dr. Vikram Kumar S. Jani from Veterinary Medicine. Over to you, sir.
Okay.
Welcome.
Is it visible, ma'am?
Yes, sir, very much.
Okay. First of all, I would like to thank LMHI team 2021 for giving me such opportunities to share my experience and knowledge, whatever I have gained in 20 years in veterinary homeopathy field condition. Basically, I am a veterinarian. Right now, I am a student of Kerala Veterinary and Animal Science University for the course of postgraduate certificate in veterinary homeopathy. Since long time, I am treating the animals, especially large animals, in dairy sectors also. Since today, I have treated more than millions of animals with various disease and disease conditions. Regarding the disease or disease condition, with help of homeopathic formulation and with or a single remedy also. Next. Coming to the introduction, lumpy skin disease is newly emerging highly infectious viral disease, and it is characterized by high fever, typical multiple nodular lesions. At predilection sites are skin of the head, neck, perineum, genitalia, udder, and limbs. Our farmers have great loss, great economic loss due to decrease of milk productions. Some animals may abort, which leads to infertility, and cutaneous nodules on the skin and hides, which damage hides also. The epizootic started with 4 cases in October 2020 and reached to peak with 17,079 cases in September 2021. We can see here what a prevalence of this disease. During this 1 year, total 37,451 cases of LSD, lumpy skin disease, were treated in Amol milkshade. But we are seeing that there is no any rational treatment in allopathy. What we can say, so veterinarians are also treating such cases empirically. I conduct this study to know the effectiveness of homeopathic medicines in lumpy skin disease in cattle of Anand district of Amul milk state. Regarding the methods, I have used 2 types of homeopathic formulations for the treatment of affected animals. Oral drop formulation. For why I have selected oral drop formulation? Because easy to advocate to animal. Farmers can give oral drop on chapati or feed material or directly to the tongue of the animal. In this formulation, I have added 6 medicines for oral drop solution. Merksol 200 potency I have selected because which is more effective on mucous and serous membrane, vesicular or pustular eruptions on skin and slimy saliva of animals. Second one is Natromur in 30 potency. I have choose because due to higher fever, some animals may become dehydrated, and due to very dehydration condition, some animals unable to get up. So third one is Rustox in 30 potency. There were animal having intense burning, itching, cellulitis, hot, swollen joints. Sometimes animal having rheumatism. That is why I have used Rustox 30 potency. Fourth one, arsenic album 30 potency. Arsenic album, as per my experience since today, Whenever in viral condition, I have used arsenic album 30. And one more symptoms I have observed, that is animal become fear and feeling weakness during this viral conditions. Arsenicum album increase sensitiveness of skin also I have observed. So I have added arsenic album 30 potency, especially Hepar sub 200 potency. There were unhealthy skins of animal. Abscess, suppuration is there. To subside suppuration, I have used Hepar sub 200 and Thuja 30 potency with Thuja. I feel that Thuja is one of the important constitutional remedy in veterinary practices. These 6 medicines, 2 ml equal proportion in 60 ml bottle, I have collected and 15 drops as a doses at every 3 hours interval per day. This is the oral drop formulation, and another formulation I have used for topically used on the nodule and lesions of the animals, which contains calendula mother tinctures. I have observed that calendula is a remarkable healing agent when applied locally, and it promotes healthy granulations. And echinacea mother tincture and thuja mother tincture also having anti-infective, which control the bacterial and viral infections. I have observed very excellent result by using these topical applications in 60 ml bottle with 20 ml of each equal proportion 3 times per day. This is my method of treatment. I come to results out of 1004 animals treated with homeopathic treatment. I got result in 783 animals recovered, totally recovered. 78.20% animal totally recovered in within 7 to 8 days, and 221, that means 21.80% animals were not responded treatment satisfactorily due to severity of disease. There are some animals having very much dehydration conditions, unable to get up, improper doses. We have shared this medicine to our veterinarians and village resource person also, where we have found these cases show sometimes improper doses means we have asked him 15 drops 3 times per day, but due to misunderstandings, some person using 5 drops 3 times and total 15 drops per day using. That is why improper doses were given by farmers in some animals also, and ignorance of timely dosings. Ignorance of timely dosings, when we can say that in large animals, farmers having so much work regarding agriculture and livestock routine operation also, some farmers have not given a timely dose, that is 3 times per day. So that is why we have got 21.80% cases were not responded satisfactorily. In such appalling severe cases of lumpy skin disease, homeopathy treatment offer encouraging response. And I concluded that homeopathy is not only alternative. Everyone's told that homeopathy is alternative one, but this case, this lumpy skin disease proven that homeopathy is proven therapy for lumpy skin disease in bovines. I feel lots of happening that lots of veterinarians also thinking that homeopathy, how can it works? There is a time to spread knowledge, to aware the veterinarian, to aware the farmers regarding the homeopathy. At last, but not least, I acknowledge our managing director of Amol Dairy, which is the Asia's largest, biggest cooperative milk producers union, Amol Dairy, Sri Amit Vyas sir, my colleagues veterinarians, village resource persons and milk producers for giving me such opportunity to show my lovely animals. Thank you.
Thank you, sir. We had
Thank
a
you.
great experience today by learning scope of homeopathy in veterinary medicine also. Thank you.
Thank you, ma'am.
And really, it is a big thanks to homeopathy that it works not only for humans, but also for animals and other species also. Thank you.
Yes, ma'am. Thank you.
May I now request our chairperson, Dr. Mohit Mahajan, to give his suggestions in this particular topic, sir?
Good evening, Jan sir. It was
Yes.
a brilliant presentation on lumpy skin disease. Recently, like you in Pantnagar, in the Tarai Hill area of Uttarakhand, we also had quite an extensive outbreak of lumpy skin disease. I think it was probably the whole of North India was affected.
Yes, sir.
But as far as I know, most of the therapy was symptomatic,
Yes, yes,
based
sir.
on lesions and what type of abnormalities, if someone has a diarrhea, difficulty in eating, a symptomatic therapy and a basic preventive protocol to evaluate whether a bacterial infection might have set up, cause this lumpy skin disease is quite similar to the pox virus that we observe, the pox
Yes.
virus. Sir. Absolutely. There are some things that I wanted to ask. One
Yes.
was that, sir, you mentioned that the medication was given along with feed such as chapatis and rotis. So
Yes, sir.
doesn't that we always recommend homeopathy to be given as a sole treatment and to avoid any change in feeding statuses of the animal whenever homeopathic medicine is given? Did you think any changes might have occurred during the therapy, sir?
Yes, sir. I have observed that with roti, with chapati, or with feed materials, you can give homeopathy medicine. There is no any alteration in the result of the disease condition. We have got excellent results, sir. As per my 20 years experience, sir, it's there is no any obstacles, or there is no any problems regarding the medicine giving with food materials, sir, as per veterinary aspects, sir.
Okay, okay. Very nice. There's one more question that you mentioned, sir, that you use mother tincture
Yes,
for
sir.
topical applications, especially
Yes, sir.
calendula and two other medications.
Yes, sir.
I wanted to ask that you mother tinctures are quite strong medications. So is there any side effects relating to application of mother tinctures on skin?
No, sir. Actually, I have observed that within, sir, 2 to 3 days, pus forming nodules, lesions were subside, and healing process is healthy granulation is continuous, sir. Within 2 to 3 days, I have observed in large animals, sir.
Okay,
Excellent
sir.
result of calendula and echinacea mother teacher with thuja also.
The medication. All right. Thank you so much, sir. We have observed that you were able to treat more than 78% of animals within 7 to 8 days, and that is quite significant. Where lumpy skin disease usually requires about 2 weeks of treatment because it's a viral infection, and
Yes, sir.
subsiding it can significantly impact the economy of a farmer, especially marginal farmers in rural areas where economy is quite a chief concern as far as treatment is concerned. Thank you so much, sir.
Yes, sir. And one word I would like to add, sir. Our Amul has one motto: is within short term we will produce antibiotic residue free milk, sir. And we will, because we have some problems regarding export to our milk products also. That is why we are encouraging the homeopathic treatment in veterinary conditions, sir.
Yes, absolutely right, sir.
Thank you, sir.
Thank you, Dr. Mohit, for your feedback. Let me now invite our next speaker from Agro Homeopathy, Dr. Ilyana. Dr. Ilyana?
Yes, hello everybody, and thank you for the opportunity offered by the LMHI to share my experience with the research I made in agrohomeopathy, as I will show. Now I will share the screen. Just a moment to see where is my presentation. So as you can see now. It was a doctoral thesis which I made, I finished last year about pest control through agrohomeopathy in fruit species. And this is the cover of the doctoral thesis. I did this under the coordination of Professor Florin Stănică from the Faculty of Horticulture in Bucharest. The work consisted in 8 chapters, and it resulted in publishing also 7 scientific articles as first author, out of which 3 articles listed as ICA. The research was made between 2017 and 2020 and aimed to study the effects of homeopathic preparations on pest control in fruit species and also to highlight the changes they produce in plant physiology. So the personal research had these objectives. As I said, to highlight the effects of homeopathic preparations in the control of pests. And also in the beginning, I showed the effects of homeopathic preparations on plant germination, using for this seeds of Asimina triloba dunal, or the northern banana, this being an original model used for germination under homeopathic treatment. To see if these homeopathic preparations can act directly on plant physiology, and in this way promoting the defense action against the biotic stress. Another experiment I made was to control the pest Acheria cuco in goji berry plants, and I will refer in my presentation to this part of the thesis. So the experiment was made on goji berry or Lycium barbarum plants attacked by Acheria cuco, and I showed the effects of homeopathic preparation obtained from the leaves of Acheria Lycium barbarum attacked by Acheria cuco. This being a kind of nosode, which can be used usually in any attack of pests, I think, because it showed very good results, not only in my experiment, but also there are such examples in literature. And also I tried to see if a particular remedy has a good effect on this pest attack, and I used Tuya with a potency of CH30. So the experiment took place at the University of Agronomic Sciences and Veterinary Medicine from Bucharest in the vegetation house of the faculty. And I used 2 genotypes of Lycium barbarum named B1 and B2. The treatment started at the end of the vegetation period of 2017 and continued in 2018. This being the first experiment, and then there was a repetition in 2019 where I gave some improvements to my study.
Apologies, Dr. Ilyana. Can you please scroll down with the slides, please? We're just able to see the cover page of your presentation.
I don't know. In my, I see here. You also have my presentation. Can you share screen with what I sent you, or maybe I can try to show it in a poster form, because for some reason it doesn't work like this. I have also a poster. Let's see if it can be shared. Just a moment. Can you see the poster?
Yes, your screen. Yeah, we can see your screen now.
Only a short form. It's a short form of the paper, but you can see it as you have to follow also the text. So I have already told you about the aims of the result of the study. And now you see here the Gauzy experiment. As I told you, it took place in the vegetation house on these two genotypes. And the plants were treated homeopathically once a week using 100 milliliters of solution for each pot. There were two genotypes in each type of treatment, and with 10 pots for each variant. There were 5 variants, beginning with a control group treated only with plain water. There was also a chemical control treated with abamectin, which is an acaricide used usually in such situations. And then we had the study groups, which were treated, one of them with dilution Acheria cuco CH6, one group with Acheria cuco CH30, and another group with Tuya CH30. The frequency and intensity of the attack, the length of the stems, and the degree of fruiting were calculated. Now, about the results obtained, in the first experiment, as I said, there was a kind of preliminary study beginning with the end of 2017 and continued in 2018. The best results in genotype B1 were obtained with Acheria cuco CH30 and Tuya CH30. In B2, the best results were obtained with Tuya CH30. I made also statistical analysis. Student t-test showed favorable results, especially for Tuya CH30. Where I made comparisons with the untreated control, but also with the chemical control, and there were very good results in Tuya CH30 when comparing with the chemical control in B1 and equal to the chemical control in genotype B2. During the same period, treatments with Acheria CH30 were also superior to the untreated control, but not statistically significant. In the repetition I performed in 2019, it was very interesting that at the beginning of the season, after a period where I did not make any other new treatments, the effects from the previous years were still maintained, which is very important for our study and for the farmers, because from one year to another, they still will have results from the previous years when the plants were treated. The best results regarding medium intensity of attack were obtained at the end of the study, again with Tuya CH30. Here we had the best results, and Acheria CH30 also had good results, both in relation to the untreated control and to the chemical control. Regarding the medium frequency of attack, positive results were obtained in both cases, but only in relation to the untreated control. Compared to the chemical control, a statistically significant result was obtained only for Tuya CH30. Then I studied also the maximum stem length and the number of fruits, and here the highest increase and the largest number of fruits were obtained again with Tuya CH30. So it was a very good choice to use Tuya CH30, and I did this particularly thinking of the immunomodulatory effect of Tuya, which is known also in humans. And as you can see, the plant here, goji berry plant, attacked by Acheria cuco, there are these galls on the leaves where the mite is hiding, and they look very much like warts. So for this reason, I thought that possibly Tuya will work very well. You can see me working here in the vegetation house. Here are the pots and then the fruits of the plant. And as a conclusion, homeopathic preparation used in the present study can contribute to the health of the goji berry plants as an accessible measure because it has very good economic rentability and is a very easy to perform treatment, taking into consideration that Tuya CH30, but also Acheria CH30 dilutions showed favorable results in controlling the Acheria cuco attack. So this was the study, a fragment of the thesis concerning this goji experiment. So this is all, and thank you for your attention. I'm sorry that you could not see the PowerPoint presentation where I had also some more pictures. If there are some questions, I'm ready to answer.
Thank you, ma'am. It's a wonderful study and a great discovery in agriculture.
Thank you.
Can I now call upon Dr. Mohit to have any suggestions?
I have just a couple of questions. Even though I'm from the veterinary background and I have quite limited knowledge about agriculture sciences, but your research was quite explicit and it was quite say innovative, I'll say, because homeopathy is probably not imagined to be used in case of plant medicine, and especially where pests are concerned, and whereas Indian conditions, pest has been a major issue among farmers to be a limiting to an economy or the growth of any farmers. There's one thing that using these medications in plants does that affect any have any effects on the fruits? Means if the fruit has been consumed by us, will that effect be propagated to us using that medication, homeopathic medication as well?
No, actually, the dilution used, the CH30 potency, does not remain as a substance in the plant, and it has only the effect of ameliorating the physiology of the plant and of making the plant to defend better against the biotic stress. So it has no effect on humans. It's not like taking Tuya.
Okay.
No.
All right. And
there are not such studies, but I'm sure this is not the case. I mean, if we were to study this, I made some studies, for instance, about the metabolic changes in plants, with, as I said, in germination in plants. There I saw that chlorophyll, for instance, and carotenoids have certain differences between the treated plants and the untreated plants. There are such type of changes. Other changes cannot be put in evidence.
Okay, so when you were studying the germination of these seeds, were these similar effects of protection against the pests were propagated to the progeny germination siblings as well?
I did not make these studies on goji berry to compare if there were some results afterwards, but I'm sure there would be results, because the plant which was treated initially will have a better defense because of a better physiology, a better metabolic background. But what I did was on Asimina triloba, because this was a model which was first time used in homeopathy, but was a very good model used in the Faculty of Horticulture since 1995, and there was this opportunity to use this model for homeopathy also. But Asimina triloba has not problems with pests. I mean, in the Faculty of Agronomy from Bucharest, there were no pest attacks on Asimina.
Okay, thank you so much. Thank you, Eliana.
You're welcome.
Thank you, sir, for your inputs. Let me now call my co-host, Dr. Deepika Bhatnagar, to take over the virtual dais.
Thank you, Dr. Bharti. Dr. Sujit Makkar, we have a question from you from the audience.
Hello.
Hanji, Dr. Makkar sir, we have a question for you from the audience, that what was the dosage of repetition when you were taking care of the kittens?
It depends on the situation. If it is a acute condition, we can repeat within 3 hours, 3 hourly or 4 hourly. It may be 2 times a day. According to the condition, we have to decide. In this case, we have given 2 times a day.
All right, say, even though it has been a surgical case, it was a surgical case.
Yeah, it has been a surgical case.
You thought that it should not be acutely taken care of like some hours in human.
No, not like that. Not like that. But because we have to see the LACM, that is, we follow the rules, that is LACM. Okay, according to that, the prolapse over here, that is to be managed actually.
Right.
First, we have washed with ice cold water. Then we have put
Yes.
some. Then we have applied some
Xylocaine.
Xylocaine jelly over there. Then we have
Yes.
placed some calendula cream over there. Then we have replaced that. That is a management. Most probably, in every case, every rectal prolapse, we take the case. In every case, we have to do first management the case. Manage the case, then we have to start the medicines. Okay. Since it is staining a lot, that's why we have given this CP and Ruta. And Ruta is always a preferred medicine for ligaments. And there's
Yes,
always a weakness of the ligaments and the tendons. This why prolapse is there. So Ruta is one of the best medicines we have given every time and everywhere in every case.
Yes, sir. And we definitely had some good results also.
Yes, yeah. We have
So
every time
now-
we got good results. Yeah.
So we don't now have any more questions from the audience. So I would now request our esteemed chairperson, Dr. Mohit Mahajan, to just summarize the presentation of the session, sir.
Thank you so very much. And it was really an honor sitting here and listening to such great vets and agronomists talking about homeopathy in veterinary and agriculture sciences. It is not something that is quite acceptable right now for me to expect that homeopathy has done such wonders even in veterinary sciences and is still not being used as an applied medicine. It has been a recent case, like Dr. Jan said, that the antimicrobial load, or we can say the antibiotic withdrawal time in animal products such as milk and meat has been significantly impacting the productivity potential and the export, because export is probably the best resource generation right now for animal products, and using homeopathy, which has, I think, minimal or to no withdrawal period in milk products, has led to significant impact. Dr. Sujit also mentioned the use of homeopathic medicine in severely acute cases that are quite fatal, I'll say, especially prolapse conditions, because such conditions, even though require surgical management, are supposed to be treated for a primary intervention. Most cases usually have an electrolyte or a calcium phosphorus imbalance, or staining procedures that might require deworming procedures prior to restabilization of animals. So homeopathy curing in such conditions has led to a significant impact. Thank you, sir, so much. Dr. Ileana also mentioned the use of homeopathy plant sciences, something that is quite astonishing right now for me, because it's been used by humans as far as I remember, using in its plants. And I think it is probably justifying that homeopathy might be the next elixir of life in the coming century and replacing probably a lot of allopathic medicines soon on. Thank you. I'd like to thank the LMHI organizing committees and everyone in this conference, because this has led to a significant impact, and I expect that veterinary might soon be using homeopathy as a major part of its medical treatment. Thank you so much.
Thank you, Mohit, sir. Yes, we all have seen homeopathy doing wonders in the humans. Now we have seen its magnificent results in the plants and animals here too. So now the LMHI has taken up the logo that homeopathy, medical science, ahead of its time. And as you said that in the future, homeopathy is the elixir of the life. And I hope we all take up to homeopathy for various ailments in their life. So thank you so much, sir. Thank you, our presenters. Lovely presentations, I must say, are very varied, distinct, unlike what we have seen. Thank you for increasing our knowledge. It has been quite enlightening. Thank you so much. So I would conclude the session here. Thank you.
All right. So before
Thank you,
before we leave this platform, can we have all eyes here? We have a quick picture we will take with everybody on the screen.